Thank you for joining this informational session. So for those who don't know me, I'm Chanel Dupree, and the program that I'm going to be discussing today is Sinking Child Welfare. And that actually stands for Simplifying Your Navigation and Confusion in Child Welfare. And if you are on this call, you work, are involved, or care very deeply about families and children who are in and around the family and child welfare system. And so I'm going to be answering a few questions on today that I'm asking, which is how can we get on the same page? Number two is who is we? Number three is why is it necessary to be on the same page? And number four is how is the Sinking Child Welfare Program help to make this happen? So how do we help do that? My girls and I were traveling to New York a few years ago for a dance competition, and I wanted them to experience all things New York. So we decided to take a ferry. But in order to get to the ferry, we wanted to like have the New York subway experience. And so we made it down into the subway area and we were waiting on our subway train to come. We were on the platform and we were kind of in a semicircle. And my daughters kind of froze and they just stared at me. And I said, "What? Like what's going on?" And then I heard it and it was a woman screaming. And so instincts just kind of kicked in and I ran over to where she was and there was a woman who was standing in front of a baby stroller and there was a baby in the stroller, but she was screaming, "My son, my son." And so by this time there were several people who like had surrounded her and we were kind of like, "Okay, your son is right here." And she said, "No, my other son, I think he may have gotten on the subway." And she pointed to a subway cart that was whizzing past us. The doors had just kind of closed. And so immediately a man runs and he picks up a phone that's stationed in like this blue box thing. And he tells the operator to stop the subway trains that we think a child has gotten on accidentally. Me and the others are surrounding her and we're asking her to describe what her son has on, how old he is, how tall he is, what color hair he has, what color shirt he has, all these different things. And so then several people, they heard this information and they went up and down the platform and they were looking for him. They were calling his name. And my daughters actually, they leaned down and they started comforting the baby who's in the stroller who's crying because his mom is distressed. And so all of this is happening at the same time. But just kind of reflecting, I started thinking about what was or wasn't happening in this moment. And what wasn't happening is no one said to the mom, "Why didn't you watch your son more closely?" No one's had a meeting about how to figure out how we could help. People just naturally helped. They quickly began to organize and really just wanted to help, right? How do we get this child back to his mom? People were working together and everyone who helped just kind of helped. Like they were just able to do what they needed to do. And then in the end result, the child and the mom were reunited. So they ended up stopping the subway trains and they searched for the child on the subway station, in the subway cart, and they found her son. He had gotten swept up in the crowd and he had just gotten on the wrong train accidentally. It was a lot, right? It was a lot. And it really was only 7 minutes, but it was likely the longest 7 minutes of that mother's life. And so that's really the basic framework of the Sinking Child Welfare Program. People being on the same page, not wasting precious time in confusion, and just really understanding that time is of the essence and peace of mind must be a priority. And so as I am explaining and I'm unpacking this, I'm going to be doing more showing that I am talking. I want to show you what this program is. And so I asked you a few questions. How can we get on the same page? And when I think about what happened in that subway station, I think about like the child welfare system. How can we be really coordinated and make sure that that what needs to happen for a family actually happens? So we can get on the same page by people within the family and child welfare ecosystem knowing that they're a part of it. And having worked in this system for, nearly a while, worked in the system a while, and having done, especially over the last year, lots of different interviews with people who work, volunteer, are caregivers and have lived experience in the family and child welfare system, I asked a few things, asked several things. And one of the questions that I asked is for the people who, the people who work and volunteer in it, how do they thrive? Like, what does longevity look like? How can we get good people to stay doing good work and helping families? And the overall response that I heard is that the characteristics of the people who stay, who have longevity, who 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 aren't plagued with overwhelm and burnout and those types of things are the people who see the big picture. They're able to navigate the system. And so in the Sinking Child Welfare program, you're going to hear me talk a lot about the 360-degree perspective, which is seeing the big picture, seeing the big ecosystem. And so in the program, we identified 10 different systems. I didn't make them up, right? They're just 10 systems that really make up the family and child welfare ecosystem. We call it the 360-degree family and child welfare map, or the 360-degree map. And so I'm going to show you a picture of the map so that you can see what I'm talking about as we continue to move forward. And so this is going to be a picture of the map. And I won't spend a lot of time talking about what's on the map, what's in the map. We do that in the program. But what you can see, as you can see, there's 10 different systems. So we have our health system, which is our mental health, our behavioral health, our medical community. We have prevention and support, which is all the things. It's the advocacy, it's the faith community, it's our kinship providers, it's our food pantries, it's our clothing pantries, like what keeps people out and then what supports people as they come out and as they're just living life. The government. So when we think about just the way that our system is even set up, it's because of our government and how it's set up. And we have to do a better job of making sure that we're including our lawmakers in on these conversations. Of course, we have our civil court, but when I say civil court, it's not just foster care court, it's family court, which can also lead to foster care court. It's also immigration court, which immigration is kind of civil and criminal. And so it's also our tribal courts, social services. So there are many entities and organizations that would kind of fit into that. Economic needs. What do people need? Well, they need to get around, they need a place to live, they need investment, they need good jobs. So, our economic needs, of course, law enforcement, that can be a way that families can enter into the system. And then, of course, criminal court, that can coincide with a foster care case and heart resilience. And I talk a lot about this because we ask people about programs, but we don't ask them, are you proud of yourself? Right? We don't talk about those things that are going to keep them moving forward. We don't ask them, do you understand what your purpose is? Why are you here? All those different things. So heart resilience, the idea that your heart can be broken, but it can come back together again. And then of course, education and research. So these are like our schools, these are research institutions and things of that sort. And so this is how we talk about the family and child welfare system. We talk about it from a kind of from a mapping perspective. And so you need to know who you are. You need to know how you get there and what your role is, and then how do you work well with others within the system. And the way that we do that within the Sinking Child Welfare Program is called the 360-degree assessment. And so the assessment, I'm actually going to put it in the chat for you, is a way for you to kind of just start with identifying who am I in this? And you actually may be several people, but it's a great way for organizations to really just start the conversation of who am I within the system? How do you fit within the 360-degree family and child welfare map? It also goes into what I'll talk about next, which is how do you work with other partners? Gauging also your support and if you feel overwhelmed or not, or if you feel supported. And then it also assesses your organization's readiness to partner and build trust with families. And so when we talk about kind of the next phase of this, kind of some of my next questions, which are we get on the same page, right? We need to get on the same page. We need to understand where we are on the map. Um, That's great. We understand the we, right? But then we also need to understand that it's we and not just me. And I know that when I was practicing, I thought that practicing law, representing parents, representing children, all the things, I thought, okay, I just need to do a really good job with my job. Like if I know my job in the foster care system and can advise my clients of the way and the things that they should do, then I'm doing the very best that I can for my clients. Not so. I found out very quickly that I needed to understand how the social services part worked and how the administrative part worked and how we could work together. Like, I need to be in these meetings, I need to be advocating for my client, I need to be having conversations with the folks who are making decisions and recommendations because whether we talk about it a lot of decisions get made outside of the courtroom when a family is involved in the foster care system. And so I had to begin seeing that it wasn't just the court, it wasn't just me and my role as an attorney. It was the social service system, it was the administrative system, it was the healthcare access, it was education access, it was all these different other pieces that I don't need to be an expert on, but I do need to know that they exist, and I need to know how to engage them in a way that is beneficial to the clients that I was serving. And so the workshop does a couple of things. So it's called the 360-degree workshop, right? 360, same theme that we're going with. And it was really birthed out of the idea that if our systems are not supported, whatever system you're a part of, then they fail. And when I was an administrator, social service administrator, I spent a lot of time dealing and working in the area of retention. How do we keep good people doing good work for a good amount of time, right? How do we do that without what tends to creep in this very hard and complex work with families, burnout and overwhelm and confusion and quite frankly hopelessness, because there's nothing worse than wanting to help and not, right? And actually feeling like I think I'm actually harming. And so how do we reverse that? How do we do something different? And one of those ways is through this workshop. It's this timeless concept that we have to connect and we have to talk with one another and that we need one another. And so the 360-degree workshop is that. And there's really three different ways that an organization can decide that they want to engage with the workshop. The first way is through an internal staff training. So they say, hey, so my staff really need to understand and see the family and child welfare ecosystem. They need to understand the importance of partnering with others within the system, and they need some tangible tips and tools on how to partner well. And so we do this by a few things, but one of them is planning for partnership framework and then the planning for pushback framework because pushback happens. But how do you still have honest and uh, uh, goal advancing conversations and interactions? And so the staff who do this workshop, they'll have access to templates and one pagers as well. And so it's a way to bring people together and really understand, how do we make sure that we're not trying to be superheroes and shoulder this by ourselves? How do we bring people in? And so then the next way is through an external training. And so this is when organizations want to begin building a better relationship with other partners within the ecosystem. For example, this would happen if an organization said, like a social service organization said, okay, so we're having lots of misunderstandings between our workers and our foster parents, or our workers and our families, or whatever that may be. And we want to have like a workshop. We want to have a space where we can have these honest conversations where number one, we can clearly define roles because sometimes that's it. People don't, you can't expect for a caseworker to be a medical provider. You can't expect for a caseworker to be a foster parent. You can't expect for an advocacy person to be an attorney. And so some of it is understanding roles. You don't do what I do, and I don't do what you do, but there is some shared vision and responsibility in there, and how do we identify that? And so that's an external training that happens where an organization invites others into the conversation, others within the ecosystem, so that we can have that conversation. And so it would focus heavily on the planning for partnership and planning for pushback and addressing a thing. So there may be a thing that an organization identifies that they need some help with, and they need some kind of coaching surrounding. And so that's what that training would be around. It's the art of having conversations with people, and this workshop provides a structured way to do that. And then the last way would be a partnership training. So it's when organizations want to introduce a new program or a new process or a new idea to others. And I've seen this happen well, and I've seen this not happen well. And what I know is that people need to process it. People need to have a conversation. I'll give you an example. When I was practicing law, there would be times where, like, the agency, so the Department for Children and Families, would start something new. And oftentimes there was this, like, not grumble, but like this feeling of, what are they doing? Like, why are they, what's happening? Because we didn't get why? Like, why is this happening? Why is this changing? And then once I got to the agency, I was like, oh, the feds told us to do it. Like, there's all these reasons why something has to change, but unless there's that conversation, then people don't understand it. And it just feels like something else that you're asking for us to do. And so when I was with the agency and we were starting like team decision making meetings, it was a new thing in Kansas. And I said, we need to talk to the courts. Like, we need to have these meetings, we need to have these conversations. And we did. And yes, absolutely, there was pushback. Yes, absolutely, there was, why are we doing this? But they came along, right? And we have to give people an opportunity to have that conversation. And sometimes organizations are in a space where they're trying to figure out, are we going to partner with this organization? Like, do we have aligned visions and goals? And so the workshop can be structured in that way. Like, there's this thing that we're thinking of doing, and we want to include this other organization. Are we a good fit? We don't want to get married, right, before we start dating. And so it's a way to figure that piece out as well. Sometimes you're asking for other organizations' input. Sometimes you're not. You're just telling them what's going to happen, and that's okay as well. But there's a way to do it in a way where people can understand what's happening, at least understand the why, even if they don't necessarily agree. And so those are the three ways that the workshop actually happens. And then the last part of the program that I'll talk about is really how it all started. And it's called the 360-degree webinar. So what I've talked about and what I've shared is the assessment. That's really even understanding how you fit, where you are. Are you ready to partner? Do you need to do some work internally? I've talked about the workshop, the 360-degree workshop. And then lastly, it's the 360-degree webinars. What I know is that trust is a must in this system, but there are oftentimes low trust that exists for many different reasons. And when families are navigating this very complex and heart-wrenching system at times, they need to build trust, but it's hard when they don't know what's happening. They are being asked to trust the people who they blame for disrupting their family. Like, it doesn't mesh well. And so one of the ways that we can build trust and that Sinking Child Welfare is building trust is by answering families' questions and quickly. One of my core beliefs is that time is valuable and that wasted time sucks. Although I'm not going to put that on a t-shirt. But time is valuable and it's precious, and it's something that we need to make sure that we're honoring. And what I know is that when I was working with families, I would I would be answering the same questions over and over and over again. And at times it can get like, oh, I've already said this, I've done this hundreds of times, but it's new to them, right? It's new to them and it's scary to them. And we need a way to answer questions quickly, and to give people what they need, which is understanding the choice, right? Choosing how they're going to navigate the family and child welfare system. This, but years ago, I went to the judges and I said, "Hey, I want to create like an orientation class for parents who are trying to navigate the family and child welfare system." And they said, "Great, do it." And so I created this course. It was called Sync 101, but it was CINC, after the Child in Need of Care Code in Kansas. And the judges would order for parents to take it. I would always say that I say now, I can teach in any environment because when people walk into a courtroom at that time and they are mad at you for being there and just being able to teach through that and to share through that, I'm like, I can teach in front of anybody because they came in really upset that they had to be there, but they left extremely grateful and extremely empowered and like, it was like, okay, okay, I can do this. I can do this. And so that's my heartbeat. That's my thing. I want for people to understand how to navigate the system and how to do it well, because this is the thing. People have to make a choice, but they need to understand their choices. They need to understand sometimes if people don't have their questions answered, they can't get to the next part. And one of the things that my clients really were, was like, how could this happen? How can the state come in and take my child? That was like a big thing. And so just being able to really explain the system, right? The government and laws and how that all worked together was important for them. And just taking the time to do that. And so I taught these classes for 5 years, but what existed then does not exist now. Okay, what existed now did not exist then, which is technology. I couldn't figure out how to get it out of the courtroom. Like, I'm like, how do I get this out of this county? But fast forward, technology is here. And the 360-degree webinars, it's a way for parents to, not just parents, it's caregivers, it's staff, to get their basic questions answered. And so I'm going to send you a link. What am I sending? Yes, I'm going to send you a link. I'm going to put it in the chat, and you are going to be able to see the um, actual document. And then I'm going to show it to you on the screen so that we can walk through it and you can see what you're looking at. All right, so I'm going to share it now. Okay, so if you click that link, what you are going to see is a Google Doc. And in this Google Doc, it is going to lay out what the 360-degree family and child welfare webinars, or 360-degree webinars for short, are, and what they're going to be. Okay, so the one that I'm giving you access to is called Syncing Medicaid 101. And you can see I give kind of an explanation of why this was created and what it is. We know Medicaid can be very confusing and complicated. And so I worked with a woman, Kelly Green, who kind of has this unique expertise of child welfare and Medicaid. And we recorded a webinar, and then I had her to prepare a document to go along with it, because when you have access to the webinars, you're going to have access to the handouts as well. And so what I'm going to do is I'm going to navigate to the webinar now so that you can see the platform. So the unique thing about the webinars that we'll be hosting is that they will be evergreen. So you just click on instant access, click watch now, and I have to pay for it. And so I will enter my code, and I gave you a coupon code, which I think is, can someone actually tell me what that is? What is that? Webinar 360. So you just put in Webinar 360 and you apply the code. Something went wrong. Okay, so let me do this other one then. Okay, so I'll change the code. So it's going to be Jan 7 and 8. And then buy now. And then I click join the webinar. And it will launch. So the webinar will launch and people will be able to just watch the webinars as they are available. And you can see how that is going. All right, so that's Kelly. And so this is about 45 minutes or so. What I want to highlight about what I want to highlight about it is that I'm able to um, drop handouts in. And so you can see that the handouts will be located within the webinar. Hopefully people can still see this screen. I think you can. Yes, can someone tell me that you can still see the screen?
Yes.
Okay, thank you. Okay, so the handouts, and I just put a couple of the first pages for this one, but you can see that it's going to just provide, okay, this is what it is, and then these are some of the questions and answers, and then there's more to this specific one, but I just uploaded the first couple pages, all right? And so that's going to be the webinar. And that's going to be the format of the webinars. And that's how organizations will get access to it. They'll get a Google Doc and it'll have all the links in there. As you can see, the webinar portion will be fully kind of launching in February. So these will be, I'll continue to add to these in January in this month, but they're going to be things that I've heard from you that you need and that families need. So it's going to be release, how to release the release of medical and mental health records for court-involved children. So a webinar surrounding that, syncing testifying. So I'm working with a an attorney who is a prosecutor or a district attorney, assistant district attorney, and we're talking about how to testify in court because that's like an area um, of like anxiety for people, of course. Syncing Parenting 101. So this is where I'm like talking to parents directly and going through what the foster care system is and what that means and some questions that they can ask. It's not going to be legal advice, but it will be legal information, which I can share across all 50 states. Also asking caregivers 101. So questions from caregivers, common questions that caregivers typically have, and then syncing heart resilience. It's possible, and this is for parents. We talk about the resource step, but we have to talk about the heart stuff. We have to talk about how do you keep moving once people are out of your lives? Because that does happen. On this same document, it's the handout template in one pagers. And as an example, you can see so the syncing release of medical and mental health records. So you can see the document here, and as I click it, it'll prompt you to make a copy. You just click make a copy, and then it will show up for you. And as it shows up for you, again, it's like what questions do I ask? How do I not? I sent this to one of my doctor friends and she was like, oh my gosh, this is so helpful. We just had this situation where we had this mom and this dad, and we weren't sure who we could release the information to or how that needs to work. And it's because it's complicated. It's HIPAA, it's state law, it's like all these things. And so this is just a very simple, easy way to understand how you navigate it and what that actually looks like. Okay, so I have shown you well, I gave you a link to the assessment and I can show you the assessment, but hopefully you were able to go there and to look at it. It's pretty simple. It's 15 questions, I believe. And that's how people get started, right? It's how you get started in this kind of ecosystem. And you are answering questions about who you are, how you show up in this work, how you partner, what does your burnout look like? And what is your organization ready for, or what is it not ready for? And so you just complete that assessment and then you'll get the results on your screen as well. So started with the assessment, going into the workshop. And then lastly, I just showed you what the webinar consists of and the handouts that are a part of it. Okay, so that's what it is. That is what is now launching into the world. And I want to see if there are any questions. What are your questions? What are your questions? And I'll get into what the cost is and what that looks like.
I don't have any questions, but I'm excited that we're going to do this.
Yes, TFI is doing this. So that is very exciting. Thank you, Miss Owens. Okay.
I don't,
Nope.
this is Dosha. I don't have any questions, but I am excited to see this platform because I hear a lot, in the spaces that I'm in, I hear a lot of just streamline and communication breakdown. And then just knowing how everything plays a part within the child welfare system. So I'm so happy that you even went as far as, when you're talking about KDADs, and how Medicaid and Medicare plays a part in this because sometimes that's where it starts. We got to talk about insurance. We talk about children in foster care, what they can get, what they can't get, how they have to wait for mental health care services, and things like that. That's a lot of permanency information and issues that they deal with a lot. So I'm just excited to see, how this plays out and everything. So thank you for that.
Thank you. Thank you. Thank you. It's exciting. It's exciting. It's different. But I'm really, really excited about what this can do. The art of talking to one another, of having conversations, of answering people's questions, of doing it. And this is the thing. Sometimes you hear of like organizations, like for instance, like foster care organizations that have like variations of this. But the problem is that um, it can be hard for people to trust it, especially parents who are working within it, because they feel like the people that are in the system are the ones who took their child. And so there can be a low level of trust when organizations who are in it are trying to do it. With this, we're not in it, right? We're on the outside looking in, have the gift of time and experience and reflection and of just continuously talking to people to understand what are they worried about, and then creating things, templates, programs, webinars to answer those things, so that they can get their questions met. It's kind of like when you as a parent are telling your child something and then that cool like cousin tells them the same thing and they're like, "Oh, my cousin was right." Right? So it's kind of in the same vein. And we, I'm very comfortable. Like this platform is for we tell people the same thing over and over and over and over again because sometimes that's what people need, especially when they're experiencing a trauma. They have to hear it again, they have to hear it differently, and they have to see it differently. And so, if you are interested in this, that there's a few ways to do this. So, the first way would be just to reach out via email, and it can be any of the emails that you may have for me. I'll get it. The next way is to sign up for our newsletter, our mailing list. And so, that's going to be, I put all this information in the chat. The next way is to just do the assessment. So do the assessment, see what it says. It's for you. I don't, you can opt into the newsletters in that way, but I don't follow up with folks that have done the assessment. That's for your knowledge. And then lastly, play around with the document that I sent you and look at those topics that will be included. It'll continue to grow, but that's what will be available in February. And so what I talked to you about was three different kind of opportunities to engage. The first way was through the assessment. That's, low risk, no cost way that you can just jump in and say, okay, how are we with partnering? What does that look like? Do we actually engage with all the people that are involved? And how do we do that? Overwhelm. Are we overburdened? Is there a way that we can share the load? So do the assessment. So that's the first way. Then the next way would be, okay, yes, I am interested in doing a workshop or having like more conversations surrounding the 360-degree family and child welfare map and system. And so you want to have a workshop and you just want to talk maybe more about what type of workshop would be best for your organization. So you would just reach out and we can have a conversation about that. The cost for that will depend on the number of participants. So it will depend upon that. Regarding the webinars, so the webinars, the 360-degree webinar is subscription based. So what does that mean? That means that organizations or individuals can subscribe to it. And once you subscribe to it, so let's say that, so KBC, let's say KBC subscribes to it it would be for your staff and for your families and for um, your home. Like it's going to be for your organization and the people that you touch. And so, because it's for caregivers, it's for families, it's for staff, it's for volunteers, it's for all these people. And so it's going to be monthly, 1 to 10 individuals. It's in your organization, it's $100 a month. And then for anything up from that, it's going to be 1,000 plus per month for subscription and access for your entire organization. So that is how the subscription process works for the webinars and for the workshop and for the assessment. I am excited just in talking with some of you and talking with families, people who have been involved in the system. I know it's needed, and it's a gap, and this is a way to fill the gap for the families that we're serving to regain time, to have a peace of mind, and just to simplify the child welfare system. So thank you for your time. Thank you for stopping in, and you have the information in the chat, and I'll talk to everyone later. Thank you.